Ben is just a few weeks old. He's new to the world but prepared with reflexes that help get him the nourishment he needs to live. Aria is 6 months old. She processes and stores information in her memory as she interacts with her world. Piper is 11 months old, and it's clear that she has formed a secure emotional attachment to her parents and brother. Infants develop so much during their first year of life, physically, cognitively, socially, and emotionally. These occur simultaneously and affect each other. First, let's examine how infants grow physically.
The most obvious, but also the most wonderful aspect of physical development in the first year of a baby's life is the fact that they grow at an incredibly rapid pace. In the first year of life, a baby triples their weight and doubles their height. If we did that as adults, we'd all be wandering around the world as enormous giants.
At birth, an infant is pretty much all head. A newborn's head makes up 1/4 of her entire body's size. Most babies gain an ounce, that's 28 grams, per day during the first 2 months. That's nearly 2 pounds per month. After that, they typically gain about a pound, or a half a kilogram per month. And by their first birthday, they typically triple their birth weight and have grown nearly a foot. An infant's weight increase is rapid, but it doesn't compare to how quickly a baby's nervous system develops. Humans are born with about 100 to 200 billion neurons. Hundreds of billions all inside this little brain. From the time of birth through the first years of life, a complex network of neuron connections, called synapses, will grow rapidly. Everything a baby sees, touches, hears, tastes, and feels will create synapses. These lay the foundation for intelligence and emotional health. Babies are born knowing how to perform certain behaviors, called reflexes. Reflexes are unlearned, organized, involuntary responses that occur automatically when presented with certain stimuli. Infants can perform these actions just minutes after they are born, without any instruction or example. The rooting reflex is when an infant turns his head toward things that touch his cheek. Rooting helps an infant find food. The sucking reflex is the tendency for an infant to suck at things that touch her lips. Sucking helps an infant ingest food. The gag reflex is a baby's ability to clear her throat. This prevents choking on food. Like the gag reflex, other reflexes keep an infant safe. The swimming reflex is an infant's tendency to kick his legs and paddle his arms in a swimming motion if he lies face down. The eye blink reflex is the shutting and opening of eyes in response to direct light. The startle reflex is when an infant flings out his arms and legs, arches his back, and fans out his fingers in response to a sudden or loud noise. The Moro reflex occurs when support is removed from the head and neck, which causes the infant to thrust her arms out as if to grab onto something. When a baby is held upright with feet touching the floor and the infant's legs move, we see the stepping reflex. This appears to prepare infants for large muscle movement, which will help them walk later in life. All of these reflexes develop into gross and fine motor skills. Gross motor skills use the large muscles of the arms, legs, and abdomen, and fine motor skills use the small muscles of the hands and wrists. First, let's take a look at gross motor milestones. All of the ages mentioned here are averages, and babies can vary in terms of the rate of development. At about 3 months, they can raise their head and chest when lying on their stomach. Around 6 months, they begin to roll from their stomach to their back. Between 6 and 7 months, they are able to sit without support. Somewhere between 8 and 10 months, they can coordinate the muscles of their arms and legs. This allows them to propel themselves forward. They practice this motion until they master crawling. At approximately 9 months, they begin to pull themselves up to stand with support. After this, they learn that they can walk or cruise with the support of furniture or a caregiver's hands. Between 11 and 12 months, they can stand alone without assistance. And at around 12 months, they begin to walk with support, which eventually leads to taking those first unassisted steps.